Back at the Naturopath. Thanks for coming back to my channel. Before we jump into this video, don't forget, at the end of the video, you can download some free resources that I've created just for you. The Candida Diet and Cleanse Starter Guide, the Ultimate Candida shopping list, the diet shopping list, and also the Candida Symptom Tracker, which you're going to find very useful. So these are all for free. So at the end of the video, just jump into yeastinfection.org/goodies and you can download these things at no charge at all. If you have any questions, remember you can always ask those and either I can get back to you or the team. So thanks for tuning in and we'll catch up with you at the end of the video. Eric, back at the Naturopath. How are you all going? Thanks for coming back. Can irritable bowel syndrome and conditions like IC, interstitial cystitis, can they be controlled by diet? Well, what I did when I was practicing, if a patient came with IBS or IC conditions like that, I would certainly put the spotlight on what they were eating. So first thing I would look at the patient, I look at the history, the background. If they've got IBS or IC, I'd say, okay, well, let's look what you like as a child. Do you have any childhood disease, allergies? Would you put on any antibiotics, any medications? And I need to know the background of that person, particularly in terms of the medical treatments. What have they had before they came to my doorstep? And not in all cases, but I can say easily in the vast majority of cases, there were medications taken on and off multiple times, multiple rounds of antibiotics, all types of drugs were taken. And they were deemed to be no good, or the patient developed the condition after taking the drugs for some other condition, which is very common. They may start off with arthritis, but they end up with a bowel problem. They could have a headache, but they end up with a bladder problem. So I sort of see the drugs a bit like this. Let's say this is a balloon. Now, if I squeeze a balloon here, it's going to come out there. If I squeeze a balloon there, it's going to pop out there. So when you push a drug into a body, it's going to suppress a symptom. But guess what? The symptom's got to come out somewhere else. That's right. And that's why when you slap skin creams all over psoriatics, especially strong ones, they get organ problems. When you treat organs, they get skin problems. All you're doing is you're kicking the can down the road to someone else's doorstep so they can kick the can further. Remember, I've always called IBS a garbage can diagnosis, all right? Kicking the can, putting people in the can. It's the same with IC. There's causes. The two key things I look at with the interstitial cystitis, the bladder issue, I look at the person's psychology, all right? And oftentimes, if it's a female, they've had it for a long time, they're going to be anxious as hell. They're going to be upset, angry, irritated. So all these emotions can also predict certain types of nutritional behaviors or pathways that person will take. Okay, there could be addictions going on there. So compulsions, addictions, there could be eating disorders going on there. There could be relationship problems, sexual problems. All these things need to be fleshed out. All right? They all need to be fleshed out. But diet, yes. But remember, most people on these YouTube channels, if they talk about IBS or IC, it's all focused towards one thing, what you eat. But it's never usually focused towards the relationship of the person has with somebody else. Okay? Is somebody pissing them off if they've got a bladder problem? Think about it. Could be true. I've seen it. I've seen strong emotions underpinning bladder problems. All right. Especially if it started through some pharmaceutical means or other means. The diet, what needs to be determined is, are there any foods irritating the bladder? Are there any foods or beverages irritating the bowel or the bladder? If you've got irritable bowel syndrome, what's irritating the bladder? If you've got a bladder problem, what's irritating the bladder or the bowel? So determine that through either allergy testing or elimination and challenge diet. So sometimes pulling out food from that person can make a big difference to the bladder. I've seen that with ladies with chocolates and various other foods and drinks. When we pulled them right back or stopped them, there was a significant improvement in the bladder. So you can certainly do this at home yourself. So diet definitely has an effect. But whether it's curing or curative remains to be seen. Unless the underlying causes, etiologies aren't addressed, you'll never really clear up IBS. Because IBS, remember, it could be a whole bunch of different things. Please watch my videos on IC and IBS because I'm sure I've completed several of them. But that's my take on it. Diet, yes, make some changes, investigate, but look at other pathways, all right? Underlying stuff that nobody looks at. Thanks for tuning in. It's Eric Bakker again, the naturopath. I hope you enjoyed that video. Remember, go to yeastinfection.org/goodies if you want to download my free resources I've created just for people like you. These are things I used in the clinic for patients, and you'll find them very useful. It's the free Candida diet, the cleanse, so it's a good introduction on how to set your program together. There's the ultimate Candida diet shopping list, and there's also the Candida symptom tracker. yeastinfection.org/goodies. Thanks for tuning in and subscribe. Thank you.